Ohio legislators are taking the moment, working on making changes to a law that would help people who suffer from mental illnesses.
House Bill 249 works to expand when families or medical professionals can request to have a person hospitalized if they're a danger to themselves or others.
As Sydney Canty found out, it's a welcomed hope for some, but at the same time, a little too late.
The lack of care available when it comes to addressing mental health issues can ultimately become a death sentence. 35-year-old Randall Fife struggled with mental health issues for years. In August, he was shot and killed after a standoff with police. His mother, Carrie, sits at his grave, wishing things were different.
I just talked to him, just said, listen to the birds chirp.
Countless times, Carrie tried to get him help, but according to the law, he was able to refuse.
Everybody knew that he had been ill, but the resources just weren't there to mandate, him to be housed in a mental health facility.
Lawmakers are looking to make changes to House Bill 249. This bill would force a person with mental health issues to get treatment if they represent a substantial risk of harm to themselves or others, refuse treatment, or their judgment is impaired by a lack of understanding of having the illness.
The law currently requires that the dangerousness that the individual poses be imminent. As a result, some of the time, the person has already made a threat or has already caused harm to himself or others before intervention can occur.
Rico Acevedo's family says he suffered from mental health issues and was shot and killed by police in October.
You go there and you find a man in Dollar General parking lot, butt naked, doing push-ups, doing sit-ups, working out. His clothes are hanging on a tree branch, drying behind Dollar General. That's not enough right there to say that he needs some mental help. And they failed him. They never gave it to him. They locked him back up in jail and put him back in jail. Then the next thing I know, maybe a week later, he's dead.
Both families feel the bill could have changed their situations.
And I believe that my brother would still be alive. It could have saved his life. It could have helped him and got him the help that he truly, truly needed.
I feel like, damn, why couldn't have this happened, back when I needed it, and it didn't, and that's just how it is, but I'm glad it's finally maybe gonna happen.
With more local news, I'm Sydney Canty.
Now, if you or someone you know needs information about mental health support, call 211. And if you or someone you know may be suicidal or in a crisis, call or text 988.